So, good morning, everybody. We're PROSTOCEPTICS. We're a group of researchers from Massachusetts Institute of Technology. We're funded by Fundación Madrid+D through the Madrid MIT Ambition Consortium, and we're trying to change the game for scoliosis therapy. We are 3 biomedical engineers. We are in conversations with an MBA from MIT Sloan Business School to join us as CEO. Next, please. People have tried to fix scoliosis for centuries and make the spine grow straight. Next. Currently, the commonly accepted way to enforce a good posture is with a heart brace. Heart braces work by making natural posture painful and thus induce a postural behavior change. Next. That's for 23 hours a day for a period of 2 to 3 years. But what if we could control posture with no pain? What if we could teach the patient not with pain but with sensorial stimulation? Next, please. We have developed a sensorized undergarment that can monitor the posture of scoliosis patients around the clock, provide feedback to the patient on treatment adherence, and empower them to take control of their postural improvement over time. Our technology comprises inertial orientation sensors and machine learning algorithms capable of understanding posture and smart feedback to maximize behavioral change. Next, please. The only comparable device in the market is called SpineCore. It's a flexible brace that uses straps to provide tactile feedback to the patient about postural balance. Obvious limitations of SpineCore are discomfort, lack of reproducible adjustment, and lack of quantitative information about adjustment and compliance. The market price of SpineCore is about 2,500 euros. We are negotiating with Spine Corporation, the manufacturer of this device, to have them distribute our product as an evolved version of their flexible brace, since their patent expires very soon. This will facilitate our marketing strategy. Our solution is just so much better than SpineCore. Next, please. It does not hurt, does not affect body image. It puts the patient in command of their own healing and keeps track of postural improvement with decimal figures for the patient, but also for their parents, for their surgeon, safely and affordably. Next, please. Our target market comprises 2 to 3% of adolescents worldwide, those who suffer from scoliosis, adding to a total addressable market of 1 million new patients every year worldwide. Each patient can be served with a device costing about 4,000 euros, so a little more than the existing technology, but with many advantages, adding to a total addressable market of 4 billion euros worldwide per year. Our revenue would be about 50% of market price, 2,000 euros per unit, and our needs for investment rise to about 400,000 euros. So our return for investment would arrive after we sell our first 200 units, which is equivalent to a 2.5% market penetration in Spain only. Next, please. Our intellectual property has been released by the Technology Licensing Office at MIT to us as inventors. We are considering whether to protect it under our own resources, if it's worth it, or perhaps relying on our know-how as IP for the future. Next, please. No, previous, again. Our plan is to commercialize our device without medical claims initially, in the prevention and wellness category, for which we only need CE marking. But then 3 years later, we will have finished a clinical trial to get full approval as a therapeutic medical device that may be reimbursed by healthcare insurance companies or public healthcare systems for scoliosis and other conditions related to posture. Next. So this is an outline of our milestones in the near future. We have recently achieved proof of principle, protected it, and submitted publications about it. And we are currently working on closing deals with strategic investors, extending over this summer. We will have the technology ready for testing in September next year. We will then undergo system validation for a few months, and subsequently we will run a small study with subjects to prove our claims that our posture monitoring can indeed improve posture, but without therapeutic claims. We plan to obtain CE marking and start commercialization of posture monitoring without medical claims in September 2017. And as we start this first form of commercialization, we will begin a clinical trial to assess the therapeutic value in terms of outcomes for scoliosis therapy as a curative device. After the 3-year clinical trial, we will be ready to submit results to European regulatory agencies and possibly also in the United States to obtain clearance for selling our device with full medical claims by the beginning of 2021. Next, please. We have benefited significantly from ImnoSmart. It has helped us lay out our venture and identify all the critical aspects, strengths, and weaknesses, especially thanks to the help of our catalyst, Marco Mangentoni. We would like to benefit further from ImnoSmart, especially for networking. And if we win, we will use the prize on IP and legal consultancies, and also on communication and public relationships. Thank you very much for your attention.